Hello again, I'm Professor Béatrice Cochener.
And I'm Dr. Pooja Khamar, and you've made it to the final part of our 3-part independent medical education video interviews series on refractive surgery.
So today we are focusing on patients' communication, which is a critical component of clinical success. Even advanced procedures won't deliver the best results if the patient doesn't understand the rationale, the risk, the expected outcomes.
In this episode, where we'll discuss the strategies for communicating clinical benefits, setting appropriate expectations, and framing cost as an investment in the long-term visual performance and quality of life. So let's begin on the ESCRS survey data. What talks about what do you believe are the benefits of the intrastromal lenticular extraction procedures over another refractive procedures? And you would see that it's quite interesting here. The topmost one, it's the improved post-operative ocular surface. The second point, lower incidence of dry eye. So I think it just reminds us that if we take care of the ocular surface, the procedures would do better. But I think the other factors, how the KLEX procedures have a superior hand is, I would like to have your comment on the biomechanical corneal stability, the low incidence of regression, and the lower retreatment rates. What do you think about it?
I think that first of all, KLEX was just invented for doing, better than LASIK regarding the complications. So it's all about dryness, ectasia, and definitely for sure having only a small incision. So potentially in saying that, I think that we are actually achieving what we were looking for. The better respect of the ocular surface, at least for the first few months. Regarding biomechanics, we learned that we can get ectasia. So I think that today, and that's going to come again in the guidelines, we never would recommend to extend indications. That we were using the same criteria for LASIK. We should respect the same for SMILE. I get that you're doing the same.
Yeah. My PhD was on SMILE because that was the only platform over there, and the conclusion of that was the selection criteria for ocular surface or biomechanics or any patient for LASIK and KLEX procedures should be the same. And do you think this benefits give you an advantage of educating the patient? Do they get encouraged with this benefit?
I think that it's a good question because that makes me think about the way I talk to patients. And I would say that if there is some dryness or any risk factors, I immediately mention that LASIK is not for them. I try to treat, and if it's okay, I say that I do assume that the KLEX is better for them because at least for the first post-operative years we know that it's better. And if it's not as good, I consider PRK. So yeah, it's exactly this kind of argument that I use to explain that to the patients. Are you doing the same?
Yes, absolutely. I think that is what helps us. And I think this strategies or this preferred analogies or tools do help us in these discussions with our patients, counseling them about why we are choosing a LASIK or a KLEX procedure or a phakic IOL. So I think this helps us maintain the balance of transparency of what the real world data is and why we are doing.
Yeah, absolutely. We need to translate and patients need to understand. And again, it's a question of the way they trust us. So in terms of confidence, I think that it's very important for us to represent knowledges and to transfer that in real world. We are to a certain extent selling the procedure, but we need to base that on arguments. Yes. And in that regard, ocular surface make a difference between the different procedures.
What would be your approach on counseling these patients for the procedures?
Yeah, I think that for a patient, first of all, what he wants to know is how long it's going to take to recover. As soon as you know what your hand can do, I think that there are some time slots that we all have in mind. So I say, okay, within 2 to 5 days for LASIK, I must say the same for KLEX nowadays. And for PRK, they are of course informed that there is a question of recovery for the surface, so it's going to take a longer time. However, that the quality of vision is something that we need to separate from the visual acuity. So they need to be ready to feel comfortable to go back to work, but to feel a little bit uncomfortable with the light, with the sun, with the night driving. So this of course perfect vision, so-called supervision that does include the quality of vision, takes longer.
And And finally, I think there is a question we all have to talk about is the cost, the elephant in the room.
No, I think that for me, but I worked for a public hospital, I saw the issue in making the cost the same for KLACS and LASIK because I don't want to put the money in the middle of a medical decision. I always try to offer the best according to the state of the art to the patient. So, in other words, we may have increased a little bit the LASIK just to afford the SMILE to be competitive. It's very difficult to ask the patient, if you have more money, you will get that, even if we know that it may be not the best strategy. It's an ethical issue for me.
Yeah, and sometimes I think if you explain the patients, like, no, we do know that these procedures can be costly at times. So, but if you explain these patients that, we are doing a costly procedure for you, but in return it's going to help them with a long-term good quality and quantity of vision, I think that's when you can explain and convince them on why this cost is coming
Absolutely.
from.
No, they perfectly understand. And actually the patients are ready again to pay that even from the pocket because they know that, that it's a handicap. And even if we call it a functional surgery, we are really changing their quality of life. We'll all agree that honest communication is the foundation of trust and ultimately successful outcomes. Thank you for joining us for this final episode in the ESCRS Independent Medical Education's video interview series on refractive surgery. We hope these discussions have offered practical strategies you can bring into your own consultations. For sure, it was delicious to spend this time with you.
Thank you, and it was an honor to spend time with you. And thank you again for joining us for this 3 series of education.